Thailand's fish and seafood exports brought in over $7 billion in 2024, while chicken products ranked third globally. Both are key to food security. But this economic growth has come at the cost of a public health crisis caused by decades of overuse of antibiotics, which has resulted in antimicrobial resistance, or AMR. AMR impacts human health care with more patients hospitalized, challenges in delivering life-saving procedures, and an estimated 30,000 deaths each year in Thailand linked to antibiotic resistance. AMR happens when germs become resistant to drugs intended to kill them, making infections tougher to treat. Once treatable illnesses can linger, worsen, and prove fatal. Reliance upon and overuse of antibiotics by humans and animal food producers is fueling the spread of AMR, posing serious threats to food safety, public health, and trade. Weak regulation and a lack of awareness of AMR among farmers, fishermen, and agri-food producers led to a high prevalence of AMR bacteria in the livestock and aquaculture sectors. In response, Thailand brought together public health, agriculture, and natural resource and environment ministries to tackle the spread of AMR. With the support of the European Union, stakeholders have been trained in the use of the FAO Assessment Tool of Laboratories and AMR Surveillance Systems, or ATLAS, to improve surveillance systems in the food and agriculture sectors.
Continued collaboration and training initiatives like ATLAS are essential for strengthening Thailand's ability to combat AMR by promoting knowledge sharing, capacity building, and regional cooperation.
ATLAS maps national AMR surveillance systems in the food and agriculture sectors. In close collaboration with the WHO and the World Organization for Animal Health, it's a key component of the One Health approach to reducing the spread of AMR. Veterinary officers trained in ATLAS are integrating the system into their work. Summary tables and spiderweb figures summarize strengths and gaps for each laboratory assessed, helping countries build reliable national AMR surveillance systems.
I think the ATLAS program, ATLAS tool is very easy to follow, and the result, such as like a spider web, is for the lab person. It's easily to see the progress.
Yes, and is spider web show a weakness, a strengthen or gap analysis too?
Public-private partnership is essential to the One Health initiative. At one of Thailand's largest food companies, addressing AMR requires strict guidelines and digital tracking systems to monitor antibiotics from animal feed to farming to distribution.
We actively explore and implement various alternatives to antibiotics through collaboration research with the universities and suppliers, using a combination of prebiotics, probiotics, symbiotics, natural plant extracts, and other commercial available solutions.
Thailand is increasing public awareness of AMR with farmers, fishers, and consumers, and continues to expand educational programs through public health professionals and village health volunteers to work toward eliminating AMR and enabling healthy change. But it's just the beginning of a long journey. All of us must unite in the fight against AMR if we are going to halt its spread.